Welcome to the IEP in a Minute series. In this module, we will walk through present levels of academic achievement and functional performance, or present levels. My name's Caitlin Prevost. I'm a program specialist with the El Dorado Charter SELPA, and I'll be guiding you through the IEP in a Minute series, one section at a time. Present levels describe what the student can do right now, academically, socially, behaviorally, and functionally. Present levels are essential to the thread of educational benefit, serving as the foundation that drives the development of goals, services, accommodations, and supports, ensuring that each IEP component is aligned to support meaningful student progress. These areas should look familiar, as they reflect the areas listed under present levels for each student's IEP. When writing present levels, use objective data like assessments, observations, and classroom performance to give a clear, current picture of the student. Include strengths to guide supports and clearly identify needs that directly inform goals, services, or accommodations. Present levels should be updated at least annually and during any reevaluation. Remember, every documented need must connect to an IEP component to ensure a clear thread of educational benefit. Begin by identifying the student's areas of strength across academic, social, emotional, and functional domains. Gather information about how the student learns best, along with their interests, such as favorite subjects, activities, or hobbies. Parent input should be actively solicited and documented whenever the IEP team meets. Make sure to ask parents to share any concerns they have about their child's academic, behavioral, social, or emotional development. Also, ensure that these concerns are not only recorded, but also addressed throughout the IEP. Avoid documenting parent concerns solely for compliance. Instead, integrate their input into meaningful planning and supports. Prior to the IEP meeting, gather any relevant data that reflects the student's performance on state, district-wide, or other standardized assessments. This includes reviewing the results from the prior year. This helps the team understand the student's progress and areas of continued need. For multilingual learners, be sure to include their most recent LPAC scores, both overall and by domain: listening, speaking, reading, and writing. The initial LPAC is administered once at the beginning of a student's academic career to determine English learner status. The summative LPAC is given annually to monitor progress in English language development. These scores should be reviewed and updated in the IEP each year to ensure that the team has current information when planning supports. Then, you can reflect the student's participation in physical education testing. Also, make sure to include any district or LEA-specific assessments that you administer, such as curriculum-based measures or other formalized assessments that are given across grade levels. Also, you'll want to make sure that you have the most recent hearing and vision dates. Pre-academic, academic, and functional skills in a student's present levels refer to the foundational and grade level skills that the student demonstrates in areas like reading, writing, math, and classroom participation. This section highlights the student's current performance, strengths, and areas of need that impact access and progress in the general education curriculum. For younger students, or those with extensive support needs, functional skills, such as daily routines, early learning readiness, and basic communication should also be described. For students with needs in the area of communication development, the speech and language pathologist should describe relevant areas, such as articulation, voice, fluency, and language. For students with identified needs in the area of gross and fine motor development, the occupational therapist and/or a physical therapist should describe specific strengths and needs. Social, emotional, and behavior development. For students with needs in this area, a school psychologist or mental health provider can serve as a valuable partner in summarizing social, emotional, and behavioral strengths and needs. Vocational includes strengths, interests, and needs related to pre-vocational or vocational skills. Address traits such as work habits, initiative, completion of classroom or school site jobs. For adaptive and daily living skills, if students have needs in the area of self-help, specify which skills, such as dressing, toileting, feeding, etc. And lastly, health. In the health section, describe any pertinent medical information that relates to the student's educational progress. You'll also want to indicate whether the student has an individual health plan. You might be asking yourself, what if it's not an area of need? If an area of present levels is not a concern, include a brief statement summarizing the student's overall functioning based on available data, such as observations, work samples, or from other reports completed, and clearly indicate that it's not an area of concern. Once present levels are established, the IEP must indicate areas of educational need that have been identified by the IEP team based on assessments, data, and the information obtained through present levels and/or special factors. And remember, there must be a corresponding goal for every identified area of need through present levels. Thank you for joining me for this IEP in a Minute module. Be sure to check out the additional resources linked below for a deeper dive into today's topic. And remember, every IEP must be individualized to meet the unique needs of the student. The examples shared here are just that, examples. Use them as a guide, but always tailor the plan based on data, input, and what's appropriate for the student you're supporting.